works a lot on diagnostics and vaccines, and understanding how to make new vaccines, make them in large quantity. That's what we're doing all the time. That's caused us to understand about this pandemic risk and talk about it going back a long time. When this particular virus hit, we saw that getting the testing capacity up very rapidly would be very, very key. And so there's a number of companies we work with on that. You know, I've done conference calls to really get this response so that we can see what's going on. Testing is important. Drugs to reduce the disease, so we created the Therapeutics Accelerator for that. And then we're working closely with the vaccine companies, and they're the ones, although it's probably 18 months or so, they're the ones that can really get things back to where we're not worried about large public gatherings. Well, if everything went perfectly, you could do somewhat better than that, but I wouldn't want to create an expectation for something quicker. We've got to make sure it's safe. We have to build up the manufacturing capacity. And you know, our team, who's experts in vaccines, works with Dr. Fauci and his team, and I think we've got a very common message about the work that needs to be done there. Supplies, the ventilators, the masks, the protective equipment, obviously that is the most urgent thing to help the healthcare personnel. The testing capacity, you know, so that somebody knows within 24 hours, if they're at all symptomatic, we should get them a home test, can isolate themselves completely and not have that infection lead to many other infections. Over time, it's going to be building for all the vaccine constructs, that there's 7 or more that look promising. We'll probably have to build factories in parallel with testing the safety and efficacy, knowing that only probably 2 of the vaccines will be the ones we go ahead with. So it's risky, but you know, it's so important to get not just hundreds of millions, but literally billions of those vaccines, because this is a global problem. And although the US has got the most cases right now, as time goes on, the developing countries where isolation is more difficult and the health system is very weak, sadly, they're most likely to experience the most pain of all as this goes global.